So I am going to report on the workshop on health. My understanding it is the first time really that the World Policy Conference has had this type of debate around health, so it was a bit of an experience, I would say. However, we had a very lively 2 hours debate. There's the least to say that there were a lot of various points and various points of view and contributions which was brought to the debate, which was therefore very animated. So I would say that the duty to present to you the key takeaways is far from an easy one. I'd like also to add that as an industry representative, you could consider that my legitimacy to give this feedback can be limited. However, I'll try to do my best to generally summarize the main outcomes. So first, the health environment, from a government's point of view, appeared to all participants as very fragmented, lacking clarity on leadership, leading to frustration to a number of stakeholders. Some global actions have taken place over the last decade, including involvement of private foundations, like the Gates Foundations or semi-private like Gavi. And also it is noticeable that the healthcare industry has shown increased effort to facilitate access to medicines as well as vaccination. Examples were given around malaria, tuberculosis as examples. So we can say that some progresses have been done around the millennium goals of 2000s, but it's far from being satisfying. Second, there was an agreement to consider that one should differentiate health, which is linked very much to basic sanitation, food, along with the previous presentations, on medical care, which is more helping to improve the life of people and, of course, to cope with diseases when they appear. However, of course, these two, health and medical care, are not independent. 3, health improvement, measured through the life expectancy in particular, is a basic objective, which has to be tackled together with food, sanitation, environment, and education. In that respect, there was a common wish expressed that the agenda of the G20 is reorientated towards these essential issues instead of coping with successive financial crises with a very short-term view. One of the participants insisted to underline that also health is first and foremost linked to peace. 4, the present situation makes health mainly a sovereign issue and not an international issue, leading very much to local decisions, short-term financial decisions, inequity of treatment, lack of reliable statistics on data, and comparisons on health standards, healthcare systems, and productivity among countries. The question of financing innovation, so far mainly generated in the private sector or through public-private partnerships in the West, and financed by healthcare financing systems of developed countries, is largely left unsolved for the future. Concerns were expressed that some newly developed countries are just looking for a free ride on research investments financed by the Western world. In that respect, the private industry is probably the only rational agent in the sector looking for performance, while other stakeholders are lacking short and even more long-term key performance indicators. But if this industry doesn't get a stable framework to embark in the future into risky long-term investments, it may lead to attrition of future research and innovation. Also, the question of quality of control of generics, in particular the ones supplied to poor countries, was raised, as well as the integration of social responsibility as a criteria to be applied in tenders organized in the Western world to put all generic providers on a level playing field. 5, however, global governance, if urgently necessary, is not enough. There is clearly a need for local empowerment with the local development of education, healthcare systems, including training and recruitment of nurses and physicians, as well as development of vaccination. 6, and this will be my last part of my report, the workshop finally suggested to retain the following elements, largely on the base of the presentation made by Petra Lowe from Novartis. More than simply a global governance, it has been retained the notion of global health citizenship. This concept could be promoted at the coming G20. Around this notion could be developed a set of responsibility standards of good practice and proper conduct. When achieved, this could function like a code of good practice. The application of this set of good practices and objectives should be then implemented, and it is not probably the easiest thing in a decentralized way, as long as health remains a local issue. When there was some debate, there was finally a common understanding that the healthcare industry should be an important player in this setting, and the ability to contribute to take rational decisions and offer medicines and patient solutions of high quality of standards. So I would say that as long as it was a first tentative or first attempt to have this debate, I must say that this debate was very rich and hopefully bringing some new thinking for further debates in coming conferences. Thank you.